Professor.
Yes, sir. That Guan sir will be doing it, sir. Before we start only, we'll do, no, sir?
Yeah. And then I will present and then I'll end at quiz and then you start.
Which one
Okay,
you have, sir? 2 minutes.
Sir, just whoever are the panelists, no, sir, like Chandrasekhar Meshram, Stephen Lewis, sir, Abhishek, sir, and Dr. Surya, last will present, sir. So first, let Stephen Lewis, sir, then Meshram, sir, then Abhishek, sir. Follow, and if Tisa, sir, joins, then we'll have Tisa, sir, also.
So, sir, Surya, sir, will start and then we will go with
No. Sir, first, everyone will speak and then Tisa, sir. Then Dr. Surya will be the last, sir.
Sir, I'm going to open the room. The room is open now.
Okay. The program.
I'm calling you, sir.
Hi, Abhishek, can you hear me?
Welcome, sir. Good afternoon. Welcome. How are you, sir?
I'm fine so far.
Good morning, sir.
Good morning, everybody, or good afternoon in India.
Yeah. We are starting in a couple of minutes.
Good.
Hello, Stu. Hey, good afternoon.
Good afternoon, Arun. No, Stephen, how are you doing?
I'm good. How are you? A little early here, but I'm all ready.
Right.
We're going to go.
Sometimes it's too early, sometimes it's too late, depending where you are.
Perfect. Couldn't be better.
Hello, Professor Meshram. Good evening, sir. Go on, can we start?
Sir. So, good morning, good afternoon, and good evening to everyone who are joining us from across the globe today on behalf of the Indian Federation of the Neurorehabilitation, the World Federation of Neurorehabilitation, and our collaborating partners, It gives me immense pleasure to welcome you all to this very special afternoon, evening, and morning on World Brain Day 2025. This year, we come together under a powerful theme, and that just not celebrates the brain, but also the spirit of global collaboration in advancing the brain health and rehabilitation. Today is about ideas, innovations, and inspirations that transcend borders and touch lives. To set the tone for this momentous occasion, we are privileged to have with us the most respected voices in the field of neuroscience and neurorehabilitation from across the globe. And now it gives me immense pleasure to invite our esteemed guest to share a few words with us. And to begin, may I request Dr. Steve, sir, whose work has shaped our understanding of neurorehabilitation, to kindly address the gathering. Over to you, sir. Dr. Stephen Lewis, sir.
Oh, sorry. Well, it is absolutely my pleasure to be here today. Thank you so much for the invitation. Particularly, thank you to Professor Surya for the wonderful invitation. It is 5:30 in the morning this morning, but I'm raring to go and ready for this great session from the IFNR, the Brain Quest session and celebration of World Brain Day. This is a wonderful day all around the globe celebrating the importance of brain health worldwide. And again, thank you for the invitation. I look forward to a wonderful morning on my side. Thank you again.
Go on, you're mute.
Oh, I'm sorry, sir. Thank you, sir, Dr. Stephen Lewis, sir, for those inspiring words. Next, it's my honor to welcome Dr. Chandrasekhar Meshram, sir, an eminent leader whose contributions continues to influence the neurological care and neurorehabilitation across the globe. Sir, we look forward to your thoughts, sir. Dr. Chandrasekhar.
Thank you so much. Thank you for the invitation. I think I congratulate Dr. Nirmal Surya and organizers who have this wonderful event on World Brain Day. And I wish all the very success and I extend warm wishes on World Brain Day. This is the 12th World Brain Day. We had a morning session and again we're going to have evening sessions today on this occasion, and IFNR was taking great efforts to make this event successful, and IFNR is contributing greatly to the patient care and rehabilitation. All the best wishes. Thank you.
Thank you very much for sharing your vision, Dr. Chandrasekhar Meshram, sir. Next, I invite Dr. Volker Holmberg, sir, who's been showing us the way at the World Federation of Neurorehabilitation and whose pioneering work in neurorehabilitation has been a beacon of excellence, to kindly share his insights. Over to you, Dr. Volker, sir.
Okay, thank you very much. Great pleasure and honor for me to join you in this session. I think it's an excellent idea to have something as a quest, especially as it tends to motivate young people. And I think that is one of our major goals in the World Federation, to get more young people early in their career involved in the work and increase the enthusiasm for the beautiful field of neurorehabilitation. My thanks go especially to Nirmal Surya and his glorious team, and the entire people from IFNR to set this up. It's a very good idea to use such a quest to celebrate World Brain Day. We did a bit webinar last year, but I think the quest is probably a good idea and it's more fun. And we have, in some sense, to make neurorehabilitation interesting and appealing in order to increase the motivation, especially of our young people, to enter this field and stay in the field. So I wish all the candidates nowadays who have registered for the quest all success. And eventually, I'll say some words later on when the quest is over. Thank you.
Thank you very much for the golden words and from the president himself for those valuable reflections. Now I'm delighted to, and it's my privilege to welcome Dr. Abhishek Srivastava, sir, the Secretary of the Indian Federation of the Neurorehabilitation, the eminent person in the field of neurorehabilitation, to kindly address us.
Thank you, Guhan. On behalf of IFNR, I would like to welcome all the dignitaries, Professor Lewis, Professor Meshram, Professor Volker. And this is an international level quiz for undergraduate students. which is organized by IFNR on the World Brain Day. So I wish luck to all the participants, and I believe that this will help us in creating awareness both of the brain reserve per se and rehab along with that. Thank you very much. All the best.
Thank you very much for the kind words, Dr. Abhishek, sir. Now, most importantly, we move to the President of the Indian Federation of the Neuro-Rehabilitation, the President of the Asia, Oceania Society of Neuro-Rehabilitation, and the Secretary General of the World Federation of Neuro-Rehabilitation, who has been showing us the way forward in neuro-rehabilitation. Dr. Nirmal Surya, sir, a stalwart in neuro-rehabilitation and a passionate advocate for patient-centered care, to share his thought with us. Over to you, sir.
Thank you very much, Guhan. I must say that compliment to all the three mentee of mine that who have created today's program. And I'm going to share my slide. I hope it is visible to everyone. All right, so let's talk about World Brain Day. Before I take the quiz, I just want to give you a brief on the brain health for all ages is the theme today. And it is if you look at what it is, I'm sure the stalwarts from the WFN as well as WFN are there. And the theme for the 12th annual World Brain Day is brain health for all ages. And it is an annual event. This year, our commitment is to support brain health throughout the entire life. That is starting from preconception through the aging adulthood. And help uniting patients, healthcare professionals, families, caregivers, politicians, and individuals to champion the brain health for all ages. And first time partnering with the UNESCO, UNESCO SOC, SDG 3, WHO, IGAP, all together to look at the brain health. We are talking of all age, that means preconception. So, the brain health start even before the birth of the child, pregnancy and postnatal, early childhood and adolescence. The different stages has different care to be taken, how we can protect the brain and improve the brain health. So is the adulthood and the aging adult. The key message is awareness about the neurological disorder, education about the brain health, priorities throughout one's lifespan, prevention of various neurological disorder through the various healthy lifestyle, access to the neurological care, which may be diagnostic therapy regardless of economic status, and the advocacy, which is more important across the globe. The IFNR vision, which is aligned with World Brain Day 2025, is advocate for the accessible neuro rehab services, promote the evidence-based care across all age groups, support the policies for the brain health integration, and build interdisciplinary partnership. IFNR current initiatives supporting the brain health are national conferences and public awareness campaign, tele-rehab advocacy for underserved areas, capacity building workshop for healthcare provider, and community-based and family-based rehabilitation. Through the action point, we are expanding IFNR effort by collaborating with government and NGO, strengthen advocacy with policymakers, promote the research on life courses, and foster the interprofessional education on brain health. Engaging the stakeholder for the impact is what is important, both patient and caregiver, empowering through education, healthcare professionals through continuous skill development, community awareness campaign and health policies, policymaker, advocate for neuro rehab in National Health Plan. So we take the pledge for action as a neuro rehabilitation professional. We pledge to promote the brain health at every stage of life. And I will request all those who have joined from all across the country, take this pledge from early childhood to healthy aging, advocate for accessible and equitable neuro rehab services for all, regardless of age, gender, or geography, empower the patient, caregiver, and communities with knowledge, skill, and support for lifelong brain health, collaborate across discipline and sector to advance research, innovation, and best practice in neurorehab. And I'm going to show you the data today, which tells you that how collaboration across all disciplines can happen with single effort, championing the brain health awareness on local, national, global platform, aligning with WHO IGAP and UN Sustainable Development Goal. So together we commit to make brain health for all ages a reality because every brain matters. So what is IFNR quiz for brain health? How this idea came from my all the three mentees that we should do on World Brain Day a quiz for undergraduates across the country. So we have 913 eligible registration. In fact, many more wanted, but we needed to close this. 612 female and 301 male. So if you look at the age, 235 between 18 and 20 years, 469 between 21 and 23, and 159 between 24 and 26 years. Absolute young people are here. And look at the India being represented from Andhra, Arunachal, Assam, Bihar, Chhattisgarh, Goa, Gujarat, Haryana, Himachal Pradesh, Jharkhand, Karnataka, Kerala, Madhya Pradesh, Maharashtra, Manipur, Meghalaya, Mizoram, Nagaland, Odisha, Punjab, Rajasthan, Sikkim, Tamil Nadu, Telangana, Tripura, Uttar Pradesh, Uttarakhand, and West Bengal. So most of the states were represented. And look at that, maximum top 5 from these. Maharashtra is Tamil Nadu 258, Maharashtra 208, Uttar Pradesh 79, Karnataka 68, and Delhi 44. And these are the representation between 1 and 10, 11 and 50, 50 and 100 and 100 plus. So you can see that overall, there are few states which represented the more. And if you look at course-wise, BPTH, that is physiotherapy, maximum representation, 667. Occupation therapy, 49. Nursing, 60. MBBS, 46. Speech and language, 18. And others were 73, which included BPMT, BRIT, BSc, optometry, BTech in health, biomedical engineering, and BPO. So it gives, and all the specialty involved with neuroscience are part of today's. And for those who are really interested in neuro rehab and came forward, I invite them for this next upcoming neuro rehab meeting in Mumbai, which will be a real multidisciplinary collaboration and an opportunity for all of you to show cause your cause. So now it's time for the quiz, and you can scan this and you can get, you might have got the Google form. Please go ahead, and I hand over the question and the next part to the Guhan, Arun, and Geeta.
Thank you very much, sir, for the wonderful and thought-provoking words and this wonderful initiative to spread the word of neurorehabilitation across the globe, sir, amongst the young minds. So is my screen visible?
Yes, Guhan.
Okay. And so good evening, everyone. And the young brains who have been waiting for this IFNR Brain Quest 2025, where brilliance meets speed, where every neuron counts and where we celebrate the extraordinary minds that are to shape the world of neurorehabilitation. This is not just a quiz, but a battle of wits. This is a festival knowledge, and this is your chance to prove your mettle and that your brain as sharp as it can get. Tonight, we'll challenge your memory, your logic, your ability to stay calm under pressure. So are you ready to fire those synapses? Are you ready to take the ultimate brain quest? And let's begin with the rules of this high-stake quiz program. First of all, this is strictly meant for undergraduate students, and it includes interns as well. So if anyone else is there, you will not be considered for the prize apart from the undergraduates. There will be total of 50 multiple choice questions that will be displayed, and you have the answer sheet and which contains only the numbers and the 4 options, and for you to choose the correct option for the question that's being displayed. These 50 multiple choice questions will be presented to you in sequence, and each will have 4 options, out of which only 1 is correct. Each correct answer carries 1 point, and there will be no negative marking, and hence you can be bold in answering. Participants will have 60 seconds per questions, including the time taken for the quiz master to read the question, and the answers must be submitted via the Google form within the allotted time, and late submissions will not be considered. At the end of the quiz, top 3 scorers will receive prizes, and consolation prizes await other deserving participants. The quiz master's decision will be final on all and will be binding. So are you all ready? So here is the QR code for the answer sheet. So if there is any questions that you have, you can post in the chat if you have any doubts, and it will be duly addressed. So are you all ready? Going to the first question. Which lobe of the brain is primarily responsible for vision? Option A, frontal lobe. Option B, parietal lobe. Option C, temporal lobe. Option D, occipital lobe. This is where your vision begins to take shape. Time is ticking. This is the lobe that turns light into sight. And can you see the answer clearly? Running down to the last few seconds. Time for you to enter into your Google document form in case you don't have access. The link is available in the chat box as well. So going to question number 2. The blood-brain barrier is mainly formed by option A, astrocytes. Option B, oligodendrocytes. Option C, microglia. And option D, Schwann cells. This is the most elite security force in the body, and not a single atom can pass through without being noticed. And they decide what stays in and what stays out of the brain. Which of the following forms the blood-brain barrier? Think carefully, and your final seconds are running. So we shall proceed to question number 3. Hope you have all entered in your document. Which neurotransmitter is deficient in Parkinson's disease? Option A, serotonin. Option B, GABA. Option C, dopamine. Option D, acetylcholine. This is the chemical star that goes missing in Parkinson's disease. And can you name this fallen hero? And this is the molecule that keeps your movement smooth. Who am I? Coming to the last few seconds. Enter your choice to the question number 3 in the Google document. Now it's time to proceed to question number 4. Which cranial nerve innervates the lateral rectus muscle? Cranial nerve 3. Option B, cranial nerve 4. Option C, cranial nerve 5. And option D, cranial nerve 6. eyes that glide sideways owe their magic to this nerve. Which is this nerve? Who am I? And this is the nerve that's brave enough to go lateral. And what is the number? 3, 4, 5, or 6? Option A, B, C, and D. Coming down to the final seconds. Moving to the next question. Question number 5. Which neurotransmitter is mainly inhibitory in the central nervous system? Option A, acetylcholine. Option B, glutamate. Option C, GABA. Option D, dopamine. This is the neurotransmitter that keeps the calm and calms the storm down, soothes the brain, and the brake pedal in the brain, the inhibitory neurotransmitter in the central nervous system amongst these 4 options. We are coming down to the final countdown. Question number 6. The corticospinal tract decussates at the level of the option A, pons, option B, midbrain, option C, medulla, option D, the spinal cord itself. Where is the crossing over point? It's the neurological intersection where left becomes right and the right becomes the left. The final few seconds, lock your choices, move to the next. Question number 7. The Romberg's test evaluates the integrity of option A, cerebellum, option B, vestibular system, option C, dorsal column, option D, spinothalamic tract. Close your eyes and you hold still. Which is the system that keeps you upright? Think of the balance, think of the precision. Which is the system that Romberg's test evaluates? Mark your choices for question number 7 as we move to the final few seconds. Question number 8. Broca's area in the brain is involved in option A, language comprehension, option B, visual processing, option C, speech production, and option D, auditory reception. The maestro of speech, what does it do? The Broca's area in the brain. As we move to the final few seconds, lock your choices, move to the next question. Question number 9. Spasticity is most commonly associated with damage to the lower motor neurons, option A. Option B is basal ganglia. Option C is upper motor neurons. Option D is cerebellum. Muscles are stiff, reflexes go wild, and what's behind it? Spasticity is associated with damage to which of the following? Make your choices carefully as we move to the final few seconds. Lock your choices. Move to the next question. Question number 10. Which of the following is the goal of neurorehabilitation? Option A, complete recovery. Option B, elimination of all symptoms. Option C, maximizing functional independence. And option D, immediate surgical correction. A journey towards a new possibility. It's not just about cure, but about capability. And which of the following is the goal of neurorehabilitation? Lock your choices as we move to the final few seconds and move to the next question. Question number 11. Let's get into some of the clinical case scenarios. A 25-year-old man is resuscitated after a cardiac arrest. Unfortunate event. He is comatose and an MRI brain is done to assess the hypoxic ischemic injury. Which structure is most likely to show early ischemic changes due to its high metabolic demand? Option A, brainstem. Option B, hippocampus. Option C, thalamus. And option D is putamen. Hypoxic brain, which part gives out first? Which part is more prone to oxygen and blood deprivation? Lock your answers, the final few seconds, as we move to the next question. Question number 12. A 35-year-old man has difficulty in dorsiflexing his foot in complaints of a foot drop. Which nerve root is most likely involved? Option A, L2. Option B, L3. Option C, L4. And option D is L5. The nerve root that lifts your foot. Lock your answers as we move to the final few seconds and as we proceed to the next question. That's question number 13. A 4-year-old child presents with increased tone in both lower limbs, a scissoring gait and delayed milestones. MRI of the brain shows periventricular leukomalacia. What is the most likely type of the cerebral palsy? Option A, ataxic cerebral palsy. Option B, athetoid cerebral palsy. Option C, spastic diplegic cerebral palsy. And option D, a spastic hemiplegic cerebral palsy. Scissoring gaits and tight legs. Which type of cerebral palsy is this? Lock your answers and we are moving to the next question. Question number 14. A 45-year-old patient presents with inability to flex the index and the middle fingers when asked to make a fist, resulting in a hand of benediction. This is due to injury to which of the following nerve? Option A, ulnar nerve. Option B, median nerve. Option C, radial nerve. Option D is both A and B results in a hand of benediction. Time to flex your brain. Mark the answer as we move to the final few seconds and move to the next question. Question number 15. A patient with a neuromuscular disorder presents with a triple grooved appearance of the tongue on examination. Which condition is most likely? Option A, myasthenia gravis. Option B, athetosis. Option C, polyneuropathy. Option D, the muscular dystrophy. The tongue's groove tells you a different tale. The sign it is, which is the neuromuscular disorder. In the following options, that could cause a triple grooved appearance. Lock your answers and we are moving to the next question. Question number 16. A young male with distal muscle wasting and weakness shows an inverted champagne bottle appearance of the legs. Which condition is this? Option A, Charcot-Marie-Tooth disease. Option B, the Guillain-Barré syndrome. Option C, the muscular dystrophy. Option D, motor neuron disease. Inverted champagne bottle appearance. Which is the condition amongst the following that causes inverted champagne bottle appearance? Lock your answers and we move to the next question. Question number 17. A patient with a spinal cord injury develops severe hypertension, bradycardia, and headache after bladder distension. At what level of spinal injury does this typically occur? Option A, above T6. Option B, below T6. Option C, above T12. Option D, above L1. A spinal cord injury patient with severe hypertension, bradycardia, and headache. What is this condition that is occurring after bladder distension, and which level of spinal cord injury does this occur? So moving to the next question. A patient suffers transient weakness after nerve compression, but recovers completely without any Walharian degeneration. What type of nerve injury is this? Option A, axonotmesis. Option B, neurotmesis. Option C, a complete nerve transection. Option D, neuropraxia. A transient weakness after a nerve compression but recovers completely without any Walharian degeneration. Mark your answers as we move to the final countdown. We move to the next question. Question number 19. All of the following cranial nerves are purely motor except option A, facial nerve, option B, hypoglossal nerve, option C, spinal accessory nerve, and option D, trochlear nerve. There's one thing that's standing out from this, which is not a purely motor nerve. Which among the following is not a purely motor nerve? Mark your answers as we are going to the final countdown and to the next question. Question number 20. A patient with increased intracranial pressure presents with hypertension, bradycardia, and irregular breathing. This triad is known as option A, a Miller-Fisher triad, option B, Cushing's triad, option C, Charcot's triad, option D, none of the above. A deadly triad and raised intracranial pressure. Can you recall the name? Mark your choices as we proceed to the final countdown and moving to the next question. I'm sorry about this glitch. Question number 21. A 45-year-old man presents with progressive muscle weakness, especially after repetitive use of muscles such as during queuing and climbing stairs. On examination, there is ptosis and fatigability. Which neurotransmitter at the neuromuscular junction is most likely implicated in this disorder? Option A, serotonin. Option B, dopamine. Option C, acetylcholine. And option D, GABA. Weakness after repetitive use of muscles. Which is the neurotransmitter that is implicated? We proceed to the next question. Question number 22. A 72-year-old woman is brought by her family with memory loss, difficulty performing daily activities, and personality changes. MRI shows cortical atrophy. A post-mortem brain biopsy was performed. What is the hallmark pathological finding in this patient's condition? What is it that we are after? Option A, neurofibrillary tangles. Option B, Lewy bodies. Option C, amyloid plaques. And option D, beta cell destruction. Is it tangles, is it Lewy's, or is it amyloids, or is it the beta cell? Lock your answers as we proceed to the next question. Question number 23. A 50-year-old software engineer complains of difficulty concentrating and frequent headaches. Further exploring, you learn he sleeps only 5 hours daily due to work. What is the recommended duration of sleep for adults to maintain optimal brain health? Most imperative question as of today on this day. Option A, 4 to 5 hours. Option B, 5 to 6 hours. Option C, 7 to 9 hours. Option D, 10 to 12 hours. The less is bad, the more is bad. There is a range in between that is recommended. Which is that range? Mark your answers as we proceed to the next question. Question number 24. A 35-year-old man is brought to the emergency department. After a road traffic accident, he opens his eyes only to pain, uses inappropriate words, and localizes to pain. Which scale is most appropriate to assess and quantify his level of consciousness? Option A, modified Ashworth scale. Option B, Tardieu scale. Option C, Glasgow Coma scale. And option D, Pain scale. Mark your answers as we are going towards the final countdown. Lock your choices. Move to the next question. Question number 25. A 62-year-old man presents with sudden onset weakness of his right arm and leg. On examination, he has predominant weakness of the right lower limb that's more than the upper limb. Which is the artery that is most likely responsible due to its occlusion? Option A, anterior cerebral artery. Option B, middle cerebral artery. Option C, posterior cerebral artery. And option D is basilar artery. Which of the following artery is responsible for his right-sided weakness with the legs more involved than the upper limbs? Lower limbs over the upper limbs. Which is the artery that is blocked? We are heading to the final countdown and we have reached halfway through the quiz. We have 25 more questions to go and I hand over the stage to Dr. Arun Shivaraman. Arun, your mic is muted.
Good evening, everybody, and thank you, Guhan, and I thank all the professors for this opportunity. Without wasting the time, Guhan, let's move on to the 26th question. So, question number 26. A 45-year-old woman complains of ptosis in the right eye. Examination reveals upgaze restriction in the right eye. However, the abduction of the right eye is normal. Examination of the left eye is also normal. Which of the following is involved? Option A, superior division of oculomotor nerve. Option B, inferior division of oculomotor nerve. Option C, oculomotor nerve. And option D is the central caudal nucleus of the oculomotor nerve. So patient has ptosis and elevated restriction of gaze. However, mark your answers down to the last few seconds. Last few seconds. And question number 27. A 25-year-old man develops ascending weakness and areflexia over 3 weeks after an acute diarrheal episode. Which of the following is the most likely diagnosis? Option A, multiple sclerosis. Option B, Guillain-Barré syndrome. Option C, myasthenia gravis. And option D, amyotrophic lateral sclerosis, that is MND. Patient has developed a subacute illness, a predominant motor illness as per the history. What is the most likely diagnosis? Down to the last 10 seconds. Score your answers. Question number 28. Patient presents with loss of pain and temperature sensation on the right side of the body and the left side of the face. Which of the following is the likely site of lesion? Option A, left thalamus. Option B, left lateral medulla. Option C, right lateral medulla. And option D, right thalamus. Think about the decusation of the spinothalamic tracts and you will get the answer. And the facial sensation is carried by the trigeminal nerve, and the body is by the spinothalamic tract down to the last few seconds. Score your sheets. Question number 29. Damage to Broca's areas results in option A, fluent aphasia with poor comprehension. Option B, non-fluent aphasia with intact comprehension. Option C, pure word deafness. And option D, global aphasia. So, Broca's area is involved in which part of the speech production system? You will get the answer. Think about the speech pathway. Last seconds. Question number 30. The nucleus controlling the swallowing is located in option A, midbrain. Option B, pons. Option C, medulla oblongata. And option D, thalamus. So think about the structural localization of the cranial nerve nuclei. There are 12 cranial nerve nucleus controlling the swallowing. Think about the nerves and the origin of the nerves. Down to the last 10 seconds, score your sheets. Question number 31. A patient with chronic alcoholism presents with confusion, ataxia, ophthalmoplegia. Which vitamin deficiency is responsible? Option A, vitamin B6. Option B, vitamin B1. Option C, vitamin B12. And option D, vitamin E. So this deficiency is more common in chronic alcoholics, and this is the triad of the clinical manifestations seen in the deficiency of this vitamin. To the last 10 seconds. Question number 32. A 32-year-old man recovering from traumatic brain injury exhibits aggressive outbursts and difficulty in planning simple tasks. Which brain region is most likely affected? Option A, parietal lobe. Option B, prefrontal cortex. Option C, temporal lobe. And option D, occipital lobe. So these are the 4 lobes of the brain. Each lobe has their specific functions. One is about memory, behavior, motor movements, and vision. Which of the injury in these cortex can manifest as aggressive outburst? To the last 10 seconds. Now, question number 33. 55-year-old woman, post-stroke, develops spasticity in her right upper limb. Which intervention is most appropriate for focal spasticity management that impairs her daily activities of living? Option A, oral baclofen. Option B, botulinum toxin injection. Option C, intrathecal baclofen, and option D, tendon transfer. So one is the intervention, one is the oral drug, and another one is the botox injection. Sorry, botulinum toxin injection. Down to the last 10 seconds. Question number 34. A 70-year-old man post-stroke is unable to dress the left side of his body and ignores food on left side of his plate. Which deficit is most likely? Option A, apraxia. Option B, hemianopia. Option C, left hemispatial neglect. And option D, ideational apraxia. The lesion in the parietal lobe, apraxia, ideational apraxia, neglect, or hemianopia. Pick an answer. The answer lies in the question itself. To the last 10 seconds. Question number 35. A patient presents with slurred speech, difficulty in swallowing, and nasal regurgitation. Which of the following is the standard test for assessing swallowing? Option A, video fluoroscopic assessment of swallowing. Option B, MRI of brain. Option C, electromyography. And option D, ultrasonography of the neck. Which helps in assessing the severity of the lesion, of the problem that the patient has? Down to the last 10 seconds. Question number 36. A 64-year-old hypertensive man presents to the emergency department 2 hours after the sudden onset of slurred speech and right-sided weakness. He is conscious, able to follow the commands, and no signs of bleeding. CT scan shows no hemorrhage. What is the window period for thrombolysis? Option A, option A, 90 minutes. Option B, 180 minutes. Option C, 270 minutes. And option D, 360 minutes. Which is the golden hour? Time is brain. What is the golden hour for thrombolysis? Last 10 seconds. Question number 37. A 55-year-old man with poorly controlled diabetes develops sudden facial weakness on the left side. Examination shows inability to close the left eye, drooping of the left angle of the mouth, and loss of forehead wrinkling on the same side. Which of the following features would help suggest this as a lower motor neuron type of lesion? Option A, sparing of forehead muscles. Option B, presence of hyperreflexia. Option C, involvement of both upper and lower face of the same side. Option D, contralateral tongue deviation. Patient has Bell's palsy. Which is the clinical finding that to be noted? The last few seconds. Question number 38. A 35-year-old software engineer complains of recurrent tingling and weakness of the right hand, especially while typing. Balance test is positive. Which of the following is the initial management? Option A, carpal tunnel release surgery. Option B, steroid injection of the carpal tunnel. Option C, wrist sprinting and ergonomic adjustments of the workspace. Option D, intravenous methylprednisolone. So the patient has carpal tunnel syndrome. The last 15 seconds, which should be the initial management? Question number 39. A 75-year-old man with dementia keeps asking to go home even though he is at home. Which strategy can help manage this behavior? Option A, reality orientation therapy and validation techniques. Option B, physical restraint during the day. Option C, increase sedative medication to suppress the agitation the patient has. And option D, limit the social interactions with the relatives or the attenders. How will you treat this patient? Last few seconds. Question number 40. A 65-year-old man has progressive gait instability, urinary incontinence and dementia. MRI shows enlarged ventricles with cortical atrophy. What is the most likely diagnosis? Option A, Option A, Alzheimer's disease. Option B, normal pressure hydrocephalus. Option C, multi-infarct dementia. And option D, Parkinson's disease. All are the degenerative conditions in the elderly. Patient has a triad. Last few seconds, score your answers. Question number 41. The patient has loss of corneal reflex on the left side. Which nerves are involved in this reflex? Option A, afferent V1 of the trigeminal nerve and efferent is the facial nerve. Afferent facial and efferent is third division of the trigeminal nerve. Option C, afferent is V2 of the trigeminal and efferent is the oculomotor third nerve. Afferent is 9th and efferent is the 10th vagus nerve. Think about the sensory supply of the cornea and the motor nerve involved in the blink. Afferent and the efferent nerves of the corneal reflex. The last 10 seconds, mark your answers. Question number 42. Damage to which of the following tracts causes loss of pain and temperature sensation on the contralateral side of the body below the lesion? Option A, corticospinal tract. Option B, dorsal column. Option C, spinothalamic tract. And option D, vestibulospinal tract. of the four tracts which carries the pain and temperature sensation? The ascending and the descending tracts of the spinal cord. Last 10 seconds. Question number 43. A patient with cerebellar disease shows delayed initiation of movement and overshooting during finger nose testing. This is due to dysfunction of which cerebellar road? Option A. Option A. Sorry for the glitch. Option A. Sorry for the glitch. Modulation of voluntary movement and affection. Option B. Maintenance of the refreshing muscle tone. Option C. Autonomic responses, and option D, regulation of sleep-wake cycle. Question number 44. Patient has weakness of dorsiflexion and eversion of the foot after prolonged squatting. Which nerve is most likely involved? Option A. Tibial nerve. Option B, common peroneal nerve. Option C, femoral nerve, and option D, sural nerve. Which nerve is involved in the eversion of the foot? Last 25 seconds. Last 10 seconds. Question number 45. A physiotherapist is training a stroke patient with right hemiplegia. Which strategy helps prevent learned non-use of the affected limb? Option A, passive range of motion exercises. Option B, constraint-induced movement therapy. Option C, immobilization for 2 weeks. And option D, strengthening only the unaffected side. So which is involved in retraining after a stroke? Range of motion exercises, CIMT, immobilization for 2 weeks, and strengthening of the unaffected side. The last 10 seconds. Question number 46. A 58-year-old hypertensive man presents to the ER with sudden onset of dizziness, vomiting, and inability to walk. His wife reports that he veers to the right side and has difficulty in swallowing liquids. Examination reveals right-sided ataxia, Horner syndrome on the right, loss of pain and temperature over the left side, and reduced pain sensation on the right side of the face. Which is the most likely diagnosis and the vascular territory involved? A, right lateral medullary syndrome, involves posterior inferior cerebellar artery infarct. Option B, right medial medullary syndrome, vertebral artery infarct. Option C, right Pontine syndrome, that is the basilar artery infarct. And option D, right cerebellar hemorrhage, superior cerebellar artery infarct. Question number 47. A 28-year-old man complains of drooping on his right eyelid, constricted pupil on the right, and absence of sweating on the right side of his face after a neck injury. Which explains the symptoms is best? Lesion of the oculomotor nerve. Option B, lesion of the sympathetic fibers, that is the Horner syndrome. Option C, lesion in the trigeminal nerve. And option D, lesion in the abducens nerve. That is the third nerve. Sympathetic fibers are fifth or sixth cranial nerve. Last 10 seconds. Score your sheets. Question number 48. A 10-year-old child brought with clumsiness, dysarthria, and tremors. MRI shows degeneration of the cerebellar cortex. What gait abnormality would you expect? A. Spastic gait. B. Focal ataxia. C. Parkinsonian gait. And D. Step age gait. Spastic gait, Parkinsonian gait, frontal ataxia, and step age gait. Last few seconds. Moving on to the last two questions. Question number 49. 50-year-old man weakness in shoulder beyond 15 degrees. Difficulty in externally rotating his arm and sensory loss over the badge area on little shoulder. Where is the lesion localized? Option A, axillary nerve injury in the quadrangular space, upper trunk of the brachial plexus lesion, suprascapular nerve at the Sorry for the glitch. Last 5 seconds. To the last question, which is the 50th one. Patient presents with winging of scapula when pushing against the wall. He also complains of difficulty with overhead activities. Which nerve is most likely injured? Option A, long thoracic nerve. Option B, dorsal scapular nerve. Option C, axillary nerve. And option D, suprascapular nerve. There are two types of winging. Which nerve is affected here? Dorsal scapular, axillary. Last 10 seconds. The timings are over. Thank you. All the questions are over, and thank you for the participants and the chair for providing us the opportunity to conduct the best program on Friday. Over to Guhan.
Okay. Thank you, Arun.
Thank you.
You have taken a lot of pain to make the quiz, and I think they are for the different level, and I'm sure everybody must have enjoyed. Let's hear from Abhishek first. What does he think about the effort done by our mentee? Abhishek. Abhishek not there? Okay, so we move on to our president, World Federation Neuro Rehab, Volker Amber. Volker, sir, would you like to comment how you felt about the overall questions and the responses?
Well, I must say the people generating the questions did a good job. There was, however, a clear preponderance of questions related to brain or spinal cord or peripheral nerve anatomy, which I think is a good idea because it's the very basis of doing neurology on a rational basis. There was a little emphasis in this respect, which eventually could be changed. But I must say I liked it very much and was a very nice selection of easy and difficult questions.
Do you think that this sort of activity could be a good idea to do it in the future under the banner of WFNR, WFN?
Definitely, yes. People like to play and people like to play games and whatever, and that increases, of course, the level of attention also in meetings, and we should really consider having something. So we did that before on various occasions, having the quizzes and other activities, but it's certainly a good idea to proceed with that.
Thank you very much, sir, for your comment. We are waiting for the results. So meanwhile, while we are waiting for the analysis and result to come, I request Chandrasekhar Meshram, the trustee of WFN, to say his comment on the overall exercise and what are his thoughts?
I think it was a wonderful event and first of its kind on World Brain Day. So congratulations, and it was very well conducted and the questions were excellent. Thank you.
Thank you, Dr. Meshram. I move on to the Professor Stephen Lewis now, the Secretary General of World Federation of Neurology. I hope he has liked this idea of conducting this side of quiz to create the brain awareness. Over to you, Professor Lewis.
Thank you, Professor Surya. I thought it was wonderful. The questions were very, very well written. Much of my career has been devoted to writing questions, frankly, for board examinations and the like, for Continuum and various other question writing sort of exercise or question answering exercises. I thought they were incredibly well written, and both the questions and the answers and the options and very, very high level. Whoever won, I will congratulate you, but I'm sure people generally did well. But these were not trick questions, but outstandingly written questions. And thank you again for this remarkable idea in honor of World Brain Day. And it really, really highly effective questions looking at people's concept of neuroanatomy and diseases and treatment, and really terrific. Thank you again for this great idea.
Well, we are grateful to you to, wake up early morning and be here and, try and do some mental exercises along with the students.
It woke me up. Yeah.
I know. Sometimes we realize that's something we also learned today. So that's the cool part of this quiz. Now I want to hear from the man behind the screen. And these are the Arun, Guhan, Sanjeevani, and Hita. I would like to hear from all of them that how they conceptualize. These are the young people's idea. These are not my idea. I only supported them. So go from 111. Let's begin from Arun.
Good evening, sir, and good evening to all the professors and my mentor, Dr. Nirmal sir. So he started with this idea to generate a quiz competition with 50 questions for the undergraduates. As per his advice, we divided most of the questions from neuroanatomy, physiology, pathology, and rehabilitation perspective also. I hope and I wish this brings more of youngsters in MBBS towards neurorehabilitation and right from other specialties also into neurorehabilitation. And I thank everyone for this opportunity. And I thank you. Thank you, sir. Thank you very much.
Sanjeevani.
Good evening, sir. Good evening, all. First of all, I will say thank you for this opportunity. And this was a basic idea which we get from sir, and it was a great teamwork. And uniformly we divided among us small tasks, and then it is today's task is like this quiz competition which was happened. And one more time, I will thanks to all, and thank you very much.
Go on.
So first of all, I would like to thank you, sir. As always, sir makes us believe in what we do. And in fact, when sir initiated this idea, we were not sure if we would be able to take it forward. But then, as always, he brings out the best in us. And thank you so much for everything that you have done so far, sir. And we are greatly indebted to you. And this was a wonderful experience designing all the questions and the choices, and the meetings that we had together were wonderful with all the our mentor and mentees were an amazing experience that we need to write down as well. And also, I would take this opportunity to thank Hitab sir as well, because he was guiding us all along the way with what to do at this juncture. Thank you so much for that, sir.
Abhishek.
Very good program. Well attended also. How many people? 500 plus?
Yes.
Yeah. Very good questions also.
Sir, totally 758 people completed the quiz, sir.
Wow, 758 could complete the quiz. Amazing number, yeah. Amazing number. Very well done. Very well done.
So man behind all these activities, Hitav. I want to hear from Hitav. Say a few words, Hitav.
Yes, sir. I yet remember I was just talking to Surya sir on the phone one day, and sir said we should do a quiz. And I was like, sir, how will we do, and where will we get undergraduate students from? And finally, we activated our sources, sir's sources. We sent out emails, messages, and everything to people. And finally, we are here with all the right guidance from Dr. Surya, and we were yet not hoping to get 900 registration and 753 people completing the quiz. And this is one of the most remarkable things that has happened under sir's leadership at IFNR. And sir, I have emailed you the results also, sir. And so if you can just announce it in 2 minutes, sir. Goan sir is just preparing the PPT. And all delegates, please wait. The prizes are going to be discussed right now.
So, we are ready with the announcement of the prizes. The 5 consolation prizes are like this. Krishna KM, BPT, Apollo College of Physiotherapy. The second is Nishant G, BA, SLP, Sri Devraj Foods Academy of Higher Education and Research. The third consolation prize is Subhangi Banjari, BPT, Government Physiotherapy College. The fourth consolation prize is Gokul Krishna, BSc Nursing College of Nursing, National Institute of Mental Health and Sciences, Bangalore. And the fifth consolation is Prerna Jain, BPT at SBP Physiotherapy College. So we have therapists, and the third thing, getting the 5 consolation. The third prize goes Priya Gupta, the BPT India College of Physiotherapy. Congratulations. The first runner-up is Bachelor of Physiotherapy, Swami Vivekananda University, Kolkata. And the winner of the quiz is Disha Singh Chauhan, CMRIT, Radiology, Calcutta University. We congratulate them and we appreciate their effort. And it is not that, no MBBS is there, which is surprising to me, but everybody else from different part of neurosciences winning. So with that note, I congratulate all of them. And I would want to hear once again word from both Professor Volkar and Stephen Lewis about how the multidisciplinary neurosciences are really shaping well into this kind of quiz. Professor Lewis first and then Professor Walker.
Yeah, no, it's remarkable. First of all, congratulations to everyone who participated and all the runners-up, and
Stephen
of
there?
course, can you hear me okay?
Yeah.
Yeah. Congratulations to all the participants, all the runners-up, and especially to the winner. Regarding your question, I think this was a diverse, very young, but very diverse set of participants representing all of the different fields involved in brain health and, of course, rehabilitation, and incredibly illustrative of all that we do every day and all that you all do every day to improve people's brain health and, of course, functional independence. And again, congratulations to all the winners. And this is just an absolutely remarkable demonstration of how we all work together, multidisciplinary effort to make everyone the best that they can be regarding brain and neurorehabilitation. Thank you again.
The highest was 49 marks and the average was 39. So 49 out of 50 is incredible. I think I must congratulate the Disha Singh, who has been extremely smart to give all the answer. Professor Volkar, what are your thoughts after?
Well, also from my side, congratulations to all the winners, runners-up, and the winners of the consolation prize as well. I think what is very important that the distribution of the various professional groups in this crowd really shows nicely the multidisciplinary need in neurorehabilitation and what is demonstrated, and that is really quite promising. What is demonstrating that there is an almost even distribution of knowledge amongst the involved allied health professionals and all the people from various groups, which is the very good news. I wouldn't expect something like this in Europe at the moment because the situation is a little bit, as Stephen knows that, is a little bit more complicated, let's put it that way. But at least for India, it's a very good result and a very promising result that there is a tremendous share of elementary knowledge amongst the disciplines, which is good news.
So I thank everybody. I think this is the end now. The prizes will be couriered to all of them, by bank details, and they will be sent. So thank you very much, sir. Thank you, all of you. And maybe Abhishek, just a small vote of thanks on behalf of IFNR.
I would like to thank our dignitaries, Professor Volker, Professor Lewis, Professor Meshram, for their kind support and giving their time in different parts of the world, and all the delegates who participated actively, all the winners, and our quiz masters, Guhan and Arun, and the brain behind Hitav, Surya sir. Thank you very much. Thank you all. See you next time. Bye-bye. Happy World Brain Day celebration to cross. Bye.
Bye-bye.
Thank you, sir. Thank you, everybody.
Thank you. Bye-bye.
Bye-bye.
Thank you.
Bye-bye.
Have a wonderful brain day. Professor Lewis, thank you very much. We will
Thank
send
you.
the report so that it can be published in neurology at some point.
Wonderful. Wonderful. Take care.
Thank you.
Thank you.
Thank you. Thank you, sir.
Thank you, sir. Thank you.
Thank you,
Bye-bye.
sir.